What's going on, family? It's Dr. Hubbard checking in with you again with another health and wellness video. Today we're going to be discussing female reproductive health. And I'd like to start with an anatomical concept that I think is important for both men and women to understand. If you were to travel up the vaginal canal, through the cervix, into the uterus, and out through the fallopian tubes, you'd find yourself inside the female abdomen, which is a sterile environment that houses the internal organs. So it's an important reality to take into consideration that the vaginal canal is a conduit between the external environment and the internal environment and should be protected. Ladies, I want you to take into consideration that the reproductive organs that are in your body are the way that we procreate and bring life into this world. So they have to be protected. You have to be knowledgeable and aware of this phenomenon. So things like intercourse and using tampons are very important. In regards to using tampons, there's a disease state associated with the release of exotoxins from a bacteria called Staphylococcus aureus that is often found on tampons. These exotoxins can cause the immune system to go into anaphylactic shock that could result in your death. Also, in looking at intercourse, sexually transmitted infections like gonorrhea and chlamydia, left untreated, can lead to pelvic inflammatory disease. Pelvic inflammatory disease can be debilitating. It can necessitate the surgical removal of fallopian tubes or even hysterectomy where your entire uterus is removed. So guys, not to scare you, but this is really important information. You need to be aware of your anatomy and physiology and general microbiology so that you can be aware of how to maintain optimal, healthy reproductive organs. I think it's also important to mention the pH of the vaginal canal. It should be slightly acidic so that lactobacillus and other healthy vaginal bacteria that maintain the environment continue to grow and proliferate. When your pH is optimal, this prevents things like yeast and other bacteria protozoans like bacterial vaginosis and things of that nature to grow and develop within the vaginal canal. Okay guys, I also like to talk to you about pap smears. When you go for your annual examination, the gynecologist is really looking to determine whether or not there's any abnormal cell growth on your cervix. There's a virus out there that's running rampant. It's called HPV, or the human papillomavirus. There's thousands of different strands, but the two major ones that we're concerned about are the ones that grow genital warts and the ones that cause cervical cancer. When your gynecologist removes a small portion of your cervix, he sends it over to the pathologist who examines it under the microscope, and he or she will make the determination on whether or not there's any abnormal cell growth on your cervix. If there is, then there's all kinds of treatment options to prevent the growth and development of cervical cancer. So it's really important, guys, that you go to your annual examinations and you take full responsibility for understanding the anatomy, physiology, and microbiology of your reproductive organs. So guys, I just want to share those few bits of information. This is Dr. Jeffrey Hubbard with another informative health and wellness video, letting you know that education, nutrition, mental, spiritual, and physical exercise is capable of transforming lives. Before I go, I want to give a shout out to Kwame Nkrumah, rocking his t-shirt today. If you're not familiar, he's worth a Google search. Imagine if Martin Luther King was the president of an African nation. That should give you a little bit of motivation to check out what this brother was doing when he was alive. All right, guys, once again, stay tuned. Many more videos to come. Thanks for your continued support. Email me with any questions, comments, concerns, epiphanies, or what have you. drjbhubbardmd@gmail.com. Looking forward to hearing from you guys, and you should be expecting more videos soon to come. See you soon.